comment or question to the woman with a beautiful child?
Yeah, I had a question. I'm a doctor working in county hospital. Yeah. I serve the poorest and the most in need. And many people are still using the emergency room as their first avenue for medical care. In an environment where the dialogue is to repeal the imperfect healthcare program we have, where can we put the pressure to improve the existing programs we have? My husband was in LAX helping people in need, and there's a lot of...
One other thing that my wife was telling me is people are afraid to go to the hospital now because they're worried that they're immigrants and something will happen. So what can we do to help our hospital programs and also people who may be afraid to use them right now in this environment?
Well, thank you. Great question. Two pieces of the question. One is the threat right now facing our healthcare system and the efforts to repeal the Affordable Care Act and what that'll mean for healthcare. But also the concern that people have as a result of the executive orders on immigration. People that are afraid to go to hospitals and even seek medical treatment because they're afraid that that they will be apprehended by ICE and deported. First of all, on the Affordable Care Act, we shouldn't shrink from the fact that this much maligned Affordable Care Act, this Obamacare, has produced the lowest levels of uninsurance in the country's history. That is a dramatic achievement. There are tens of millions of people that have health care now that have never had it before, thanks to this legislation. And we need to save it. And we can improve it. I'd love to see a single payer or public option. Which, by the way, I voted for the public option, and that we would have been far better even had we done that. But we can save this, and we can save this because the repeal and replace was always a phony. There was no replacement. It was a slogan. And there's no agreement among the Republicans about what they would even replace it with, and there won't be. What the Republicans will try to do, and this is what we have to resist, and it's what we have to expose, and what we have to call them out for, and what we need to hold them accountable for, is they won't repeal without a replacement, and there won't be a replacement. So what they will try to do is make the Affordable Care Act fail. They will try to undermine the Affordable Care Act and argue that it's collapsing of its own weight, when if it collapses, it'll be because of the GOP efforts to destroy the Affordable Care Act. And we're already seeing their first steps to this. They are already eliminating the funding to do outreach to enroll people in the Affordable Care Act. And notwithstanding that, we're having record enrollments. But the reason they're cutting the marketing funds is they don't want healthy people to enroll. They don't want young people to enroll, because if young, healthy people enroll, then the risk pool is far better, the premiums are far lower. They want the pool of those insured by the Affordable Care Act to be older and to be sicker and to be more expensive. And in this way, they hope they can make it collapse. And they hope more plans will pull out. This is their strategy. And that way they can blame Barack Obama. They will be blaming Barack Obama for 100 years. And we have to expose this for exactly what it is. And we will not let them hide their responsibility. So this is something very important that we can do, and frankly, it's working. Your attention, your focus, your speaking out is working. And if you look at how people now view the Affordable Care Act, because of what you're doing, it now has broader support than it ever had. You know, as much as